My name is Dr. Magdalena Flores. I've been practicing in Brownsville, Texas since 1999, so that will make it 21 years, 22 years in practice. As of today, in Valley Baptist Medical Center here in Brownsville, I'm the maternal medical director. The decision to get vaccinated, whether for COVID or any other illness, is a very personal one, and it has to be made between the person who's going to get the vaccine and their medical provider. So right now for the pregnant patients, we do recommend that you have a conversation with your doctor regarding whether or not it's convenient for you to receive the COVID vaccine, regardless of the trimester that you are. That being said, if any pregnant woman watching this decides to get vaccinated, you don't need a physician authorization to get the vaccine. That is very important. But for example, when cases are going down, thankfully, and in Texas they're going down, last year here in Valley Baptist, we treated 25 patients with COVID. This year, we have already treated 18, and we're seeing an increase in the severity of the disease, especially in expectant moms in the second and the third trimester. That means that over 28 weeks, they're getting more sick. So we want to encourage moms to check with your doctor whether that vaccine will be important or not. There's some myths with the vaccine that people are thinking that it's going to cause infertility. The vaccine is not going to affect your further down the road plans to have another baby. The vaccine is not going to harm your unborn child. The CDC has ongoing trackings. They have the B-Safe, and in the B-Safe they have over 5,000 women registered, and they have a B-Safe for pregnant people, and in none of those sites and tracking devices from CDC, any side effects or damage to the unborn child has been noticed. So we do encourage everybody to have the conversation with your physician, but it's not required. Up to this moment, obviously we have to understand that this vaccine, it's not even a year old, okay? It's under emergency use administration from CDC. That's how, and the FDA, that's how they approve it, because it was an emergency situation. But as of now, the CDC, the FDA, they're tracking the millions of doses that had been administered. Like for Pfizer and Moderna, Pfizer has an efficacy of preventing severe disease of 95%, Moderna 94.3%, the Johnson & Johnson vaccine is a little bit lower, 66%. So we have to understand that we don't have years and years, and that's part of the fear that we have. But as of now, the data that we have collected, there hasn't been babies born here or in Europe that had been affected, that we can identify that they have been directly affected from the vaccine. So it's what are the risks versus the benefit. If your risk of getting severe COVID disease are higher than the benefit of getting the vaccine that is pretty new, we do understand that it's a personal decision. So if we're telling you that in the pregnant population, you can get more severely sick with flu, for example, with influenza every year, and we do get that vaccine. It's the same thing with COVID. We can get pregnant moms or moms that are newly delivered, like you have delivered in the past 6 weeks, you can get severe disease with the COVID. So it's a personal decision, and you have with your doctor to outweigh the risk. Is the risk of getting this vaccine worth the risk of getting sick, really sick with the virus? But we have to understand that we're still collecting data, okay? We're still collecting the data, but the data right now doesn't show that. The smart questions are like, number one, do you live with somebody that is more prone to get sick? Because you might decide not to get the vaccine because you're pregnant, but you might want to protect your elderly parents if you live with them, if you have smaller children that have other conditions. So that would be one thing. Is it beneficial for my family at this moment for me to get the vaccine? Number two, do I have any conditions in my pregnancy that you're telling me that I should get it? For example, patients that are overweight at the beginning of the pregnancy, because every pregnant woman will gain weight. So that doesn't mean that everybody has to get it. But if you have obesity, morbid obesity or severe obesity, then you have to discuss with your physician, should I get it? If you have gestational diabetes or pre-existing diabetes during the pregnancy or before the pregnancy. If you have high blood pressure, If you have any other diseases, any other conditions, like for example, autoimmune diseases like rheumatoid arthritis, lupus, you should discuss that. you should talk to your physician about what had happened when you had other vaccines. When you get the flu vaccine, you get a little feverish, that's expected. But if you get the flu vaccine and you get a severe reaction, if you have had a severe reaction to another vaccine ever in your life, then you should discuss with your physician, should I take it or not? So the smart questions are like, do I have any risk factors to get more sick with the COVID? Have I got sick with any other vaccines? And am I putting anybody at risk in my family by being unvaccinated? And another question is like, can I breastfeed with the vaccine? When we breastfeed, usually what we do is we pass part of our immunity from any diseases, any viruses, some viruses that we have, like the common cold virus, adenovirus, we pass that immunity to our baby. So far, what we're seeing with the COVID vaccine is that you're gonna be doing the same thing. You're gonna be passing part of your body's immunity to your baby, which as of now, we don't have an approved vaccine for children under 12. So we have to ask the physician, okay, I'm gonna breastfeed. Do you think it's gonna be beneficial for my baby if I get it? My message will be that if you got vaccinated and 2 weeks have passed from you completing the vaccine, as of now, the CDC recommendation is that you don't have to wear a mask in open spaces or big or even closed spaces that are big enough. But if you are pregnant and you decide not to get the vaccine, you still have to practice the 6 feet social distancing, wearing the mask, and most importantly, frequent hand hygiene. So the recommendations for unvaccinated individuals have not been lifted, and then the pregnant, if you decide not to get the vaccine, you still have to practice that, because it's for your own safety. Females under the age of 50 or in reproductive age that are trying or planning on seeking pregnancy can get vaccinated. You don't have to delay getting pregnant if you got your vaccine within the last 2 weeks. So there's no contraindications to getting pregnant and the vaccine, okay? And the other recommendation is they're making is like any individual under 50, any female under 50 years old that has the access to the vaccine and decides to get the vaccine should get it. And you don't need a physician's order right now. We do need, remember that we have 3 vaccines. We have Pfizer, we have Moderna, and we have Johnson & Johnson. With Johnson & Johnson, we have to be aware that females under the age of 50 have a slight risk of having what they're calling now the thrombocytopenic syndrome. It's a very rare, super rare form of blood clotting disorder that can happen and have happened with the Johnson & Johnson. It happened in 6 patients after they had administered 7.9 million doses of the vaccine. But then we as community, we have to get informed, and if I decide not to get the Johnson & Johnson, we have the other 2, and anybody who has access to the vaccine should be getting vaccinated. That is the recommendation as of today. Get informed, talk to us. Talk to your physician, even places where they're offering the vaccine, the pharmacies, the drugstores, the supermarkets. Whenever they're offering the vaccine, there's a lot of personnel very willing and happy to answer your questions. I think information, it's knowledge. The more you know, the more powerful you're gonna feel about making your own decision. Nobody's gonna shame you for not getting the vaccine. Nobody not in our hospital or any of the other facilities that deliver babies are gonna prevent you from having somebody with you at the time of having your baby because you're not vaccinated. That's very important. Nobody's gonna separate from your baby. That's not gonna happen. Not only that, the side effects of the vaccines are not different from the side effects that we get from the flu vaccine. And every pregnant woman goes very willingly and get the flu vaccine during flu season. So you can get a little bit of fever, you can get a little bit of a sore arm, mostly after the second dose of the vaccines that are 2 doses. But usually those symptoms go away within 1 to 3 days. So it will be just like having the common cold. We get kind of like sick, we don't feel ourselves for 2 or 3 days, but nothing severe. Of course, as with anything, there's exceptions. You can get a severe reaction from a vaccine, and that's what you have to discuss with your own physician or get information, should I get it or not. So it's just, my recommendation would be get educated, get informed, and then make your decision.